Okay, welcome everyone, and it's always a pleasure to talk about programs, and transportation is something that's very dear to me. I've been with Seniors Outreach Services for 18 years now, and when I started there in 1999, one of the first committees I got on was the Transportation Committee. And so it's come a long ways, but we're pretty proud of our Trans Hub. But I'm just going to take you kind of through how much work it was. So I'm supposed to use the clicker. There we go. So we started with statement of kind of the issue. Like transportation has been and continues to be the challenge for clients and agencies over and above the senior population. And I don't think there's an agency here that doesn't agree with me, the concerns. The community support agencies, such as LNA, Seniors Outreach Services, increasingly being relied upon to provide transportation for seniors, persons with disabilities, and other persons in need. We have a successful transportation program, so we are always being asked, can you help us with transportation? And it was difficult to say no to some agencies. The only choice presently available for public transportation in LNA is a taxi service. While this is needed and a welcome option, it is often not financially viable for individuals living on fixed incomes. So, and that is not anything, everybody understands that. That's nothing new. And another statement of issue that is a large number of appointments for medical care are in other communities, Kingston, Belleville, and a large percentage of clients do not live in Napanee. Lennox and Addington is a very rural area. Our catchment area is up to number 7. We go into Amherst View. We also do Amherst Island, and then Napanee, and we go right to Deserano. That's a big area. There's a lot of little towns in there. There's Yarker, Colebrook, Enterprise, all those little places. And we have transportation volunteer drivers in every one of them. And the geographic area contains a growing elderly population, which will translate into a growing disabled population in the coming decades. Our services are growing. When I started there, we might have did 100 clients, had 100 clients on our database. Now we're at close to 400, just seniors. While being able to provide needed transportation and medical appointments is critical, other transportation needs have also been identified. These include, but are not limited to, visiting family members, participating in social and leisure activities, grocery shopping. So we weren't just asked to do medical. There were a lot of other things we had to do as well. But I would say today, probably 95% of our transportation is medical. So some of the background on how this transportation group came together was there was an executive committee, and the executive of the LNA Health and Community Service Coalition held a strategic planning day. So what we had is Lennox and Addington Health Community Service Coalition. We had around 23 agencies, I believe, and that was actually brought together by Arthur Ronald, who's here tonight, and he was the CEO of the Napanee Hospital, and he thought, wouldn't it be nice if we got together and talked about some of our issues. And someone like Arthur would ask these communities to come together, well, we'd all say yes, because Arthur usually had something to talk about. So we were very pleased to come way back in 2007, and there were 17 agencies that attended this particular group. And these were some of the issues that came out of this. And we have worked on each one of these issues, and they've all had good results. And I kind of got mostly involved in the transportation. So the nice thing was that this group got to learn about the transportation that SOS offered. They thought it was really interesting how we could provide so many rides so reasonably priced. And they really wanted to learn a lot more. So that's where this group probably played a very big role, is we got to learn about each other and what each other's needs were. So some rationale was more than 15 agencies were identified as providing transportation services to the elderly or disabled as needed for outpatient or medical appointments in LNA. So more than 15 agencies. We were just one of 15 agencies providing transportation. The rationale of the centralized transportation service would allow other volunteer services to work together using a centralized dispatch service. So out of these 17, there I believe was 2, maybe 3. I know Interval House, they had some volunteers. Children and Family Services had some volunteers. And some of our SOS volunteers were also volunteers with Interval House and Children and Family Services. But what would happen is the volunteer would kind of go towards the agency that could provide them the most rides, keep them busy the most. So that's kind of why SOS had so many, because we did a lot of driving. The project would build on and work collaboratively to promote an integrated transportation system for the residents of LNA. And LNA SOS would govern this project because of the active volunteer driving service, the screening of volunteers, the current fee structure, volunteer training system, and ongoing process to recruiting volunteers. There's so much work into the volunteers, and each one of our volunteers are treated like employees. So if there's a concern and a client will phone in and say, I don't care for this volunteer, he drives too fast, whatever the reason may be, we bring the volunteer in and we say, we've gotten this complaint. Just like we would do with an employee. If something was happening with an employee and we weren't happy with, we would, explain that to them. So the volunteers in our system, the training, they get yearly training. We sometimes, right now they're going through a winter driving training session. So they really are, in my book, they're professionals. If they have an incident with their client, even though they stood and watched, we've had a client that maybe passed out after dialysis. They came back and they wrote up the whole incident report and what they did. So what this particular volunteer decided to do was he's going to take cookies and orange juice to make sure the client has something after a dialysis. But what we've done because of that situation is now we're asking all our dialysis clients to please take juice and cookies so that if anything happens, it won't happen in the presence of our volunteer. And our clients agreed that's a pretty good idea. But SOS also we coordinate a town bus. So that's a service that's paid for by the local businesses. So 2 times a week, we go around and we pick up seniors wherever they want, wherever they are, and we take them to the local bank, local shopping, to our Walmart, our Metro, wherever they need to go. And we do that 2 times a week. And we also have an accessible van. So this van transport wheelchair individuals. There's no age group to use this van because it has a lift and we don't care. There's not another one in the area. It's only $90 to go to Kingston and back. And I believe patient transfer is almost $300 round trip. So we will get the odd call and say, oh, $90 is a lot for a trip to Kingston. And we say, phone this number, and if you can get it cheaper, then call back. They always come back. So, So, in 2009, the LHIN had a strategic direction for transportation in the Southwest LHIN, including a committee to develop a regional transportation framework. The LHIN framework was to consist of developing regional transportation program management, reducing the incidence of ALC, identifying gaps in current transportation system criteria, principles that will guide planning projects to ensure they align with ideal transportation system, and address identified gaps in the Southeast. List of recommendations to strengthen current transportation and guide future planning. So I was on this committee actually and kind of listening to what they were doing, but it was so regional. You know, I said, well, we can do our own little project that at least, or try to do some kind of little project. And then maybe our little project will engage and become bigger. So the Trans Hub was working on the same priorities, only under a smaller framework, definitely not regional. SOS, I feel we've kind of worked outside of our box when we worked for the Trans Hub, but we were still within the LIN mandate. We were still trying to make sure, no matter what age you were, you got to your medical appointment. So this is the Transportation Working Group. So the working group got established to discuss, plan, and possibly develop the centralized transportation system. A lot of discussion. As you can imagine, when you're trying something new, you're bringing players together, it takes a lot of work, and I know you know that, and we've all been there. And you're also working with a lot of different agencies. So we weren't working with just agencies that were in the same funding package. We were working with anyone that needed transportation. We weren't looking, where do you get your ministry funding? We were just looking at, what do you need to get your clients to their medical appointment? So this is the current working group. We have mental health and addictions, hospice LNA, community health center, the Napanee, the LNA County General Hospital, ODSP, Prince Edward LNA Social Services, Family and Children's Services. Now, some of these agencies go through ODSP. I might as well tell you, ODSP, that's Ontario Disability, I forget what the SP is. And they transport a lot of people, and a lot of people that are under the age of 55. We used to be able to count our seniors that were 55 and over, and just in the past, just this year, we've been mandated now to start counting them at 65. So that group now, 55 to 65, is not being counted by us, but we are still serving them. So this is the group that renamed our centralized transportation system, just to get it a little bit smaller and easier to discuss, to Trans Hub. But it really should be called the Medical Hub, because all our drives are mainly medical. It really took dedicated staff from SOS to really work constantly with these agencies to make sure, okay, what is it you need, but you still have to work within our framework. Because we had a really good transportation system. We have our volunteers come in. They are trained in such a manner. And then we have a system where you refer in this manner. We check everything out. We explain to the volunteer what they're getting into. So our system was really good. So the agencies really kind of had to fall within our system. We didn't want to do a lot of changing to the system for them. So that was kind of hard for them. Well, I just want to be able to call at 4 o'clock and have somebody picked up at 5. Well, no, we're not a taxi service. We have to book. It takes us a couple of days sometimes to get a drive for you. Our dispatcher could end up calling 8 people to get one ride put together. So we really had to make sure they understood that concept. We're not a taxi. They're not all sitting in their cars waiting to go. They are home doing their thing, and they're there when we need them. So some more working our group plan. So first of all, we had to collect the information to develop this Trans Hub to meet both the user and providers of transportation services. So we had to know, okay, what kind of clients do you transport? What kind of concerns are we getting into for our volunteer drivers? And so we had to do some research there. We had to collect documentation that complements agencies providing transportation, create a seamless transportation service for our clients. We had to look at where everybody was going. Where are you going? How often? How long are you staying there? And remember, when a volunteer takes a client somewhere, and this was something that these agencies weren't used to. So our volunteer was taking a client to Kingston Hospital for dialysis. They would help the client in. They would sit with them. And sometimes they'd stay with them during that whole dialysis. Sometimes they'd leave and then come back, and then they would bring them home. They would make sure their medication, they got their medication, where do you need to go? So they did the extra things that your family member would do or your loved one. We also tried to seek out some web-based companies which supplies tracking, reporting, and measuring online between agencies. But we were so small that didn't go too far, but it's still there. But with the numbers, we have 6 agencies now that we're working with transportation, and that's something that we probably wouldn't need right now. And then we had to determine the staffing needs and the volunteer driver needs. So we had to bring these volunteers in and explain to them, these are the types of individuals you're now going to be driving. They're going to be younger. There's going to be some people from mental health. There's going to be some people from addictions. How do you feel about driving these types of individuals? And I would say 90% of them were fine with it. Because even with our own clientele, we transport Alzheimer's individuals, and we've had some situations with that. And some of our volunteers say, I'll drive anybody you want. I cannot drive the dementia, the Alzheimer's individuals. We've had clients that say, you let me off at that store right over there. And he's no, and they get very angry with them. And he took them home, and he says, I don't want to go through that again. So the situations that some of our volunteers have come up against have been quite amazing. So some of our objectives, of course, as a group, we wanted to get some seed money. And we worked very hard. In 2010, we went to KFL&A Community Capacity for some funding through the Futures program. We were not successful. In 2012, we did a partnership grant program application, and we were not successful. In 2013, we went to the Southeast Lynn. Yay, they heard us, and they gave us $55,000. And we couldn't have been more happy. We said, we're really going to try this now. All our talking, all our meetings, we're at least going to give it a shot and see what we've got. So the criteria then was to hire a person, someone that could work with our partners, to develop procedures, to develop a fee structure, develop policies, and we do have a couple policies. Safety and evaluation regarding the volunteers. We had to recruit volunteers. We have a huge catchment area. We had to make sure we had them in every area. And then determine our stats and our data collection needed for each agency as well. We wanted to show them the value, but it certainly didn't take much time after we did a few drives for them to see the value. So, and then there's always, of course, everyone likes to see the financial picture. And this is where you'll have a lot of questions that I will have forgotten to put in here regarding the finances of it. But the TransHub Working Group, we talked about charging each agency a membership fee, which would help with the administration. And asking for a membership fee of $50 right up to $4,000, that took meetings and meetings. it was hard for them to be able to say, I can give you $1,000 a year to go towards a transportation project, and then they still had to pay for their transportation. So these agencies became third-party agencies, and so we would bill them for whatever rides happen. So let's say mental health would phone us for a ride to Kingston. We would book the ride, and we would bill mental health. So when we deal with our own clients, the client pays our driver. So our 65-year-old senior, it's going to cost them $60 or $40 round trip to Kingston and back. They pay the driver. So we don't have that come through our books. So now we have a third party involved, and we have to bill mental health. So we would charge our senior 45 cents a kilometer, but we would charge mental health 60 cents a kilometer. Because now we had to bill mental health. Now we had to wait 1 to 2 months for our money to come back, but we had to pay the driver. So we were making 13 cents on our 60 cents. And they were fine with that. They had no problem. I think they would pay 80 cents. But we all agreed on the 60. But they wouldn't agree on the membership fee. And to this day, the membership fee scares them. And I don't know, if I was an agency and I could pay $4,000 to be a part of another agency where I could just call and get transportation whenever I pretty much wanted it, I think I'd want to be a member. I think I'd figure it out. But it's really difficult for those agencies to do that. So it's difficult to implement this because, as I said, each agency. And then the fee. So there was one agency that may use the service 1 or twice a month. And why should I pay $4,000 a year if I'm using that? So how do you deal with it? And of course, a huge concern for us, SOS, is the cash flow. We have the drivers up to 2 months before we are reimbursed. So we're paying them, and then we're waiting for the money to come in. So that is where we took some of that $55,000 and we used it as a float. So here's our float. We always know we can pay our drivers because they're the ones that are most important. So another financial picture. Here we go. So we received in 2012 some LIN funding, $55,000. Third-party income, estimated income, would be around $10,000. So in total, we got around $65,000. So our expenses, our drivers being reimbursed, was around $8,000. So this is a picture for a year. Our staff person was around $42,000. And then we did a fair bit of volunteer coordination, finance assistance. We had extras, we had an extra staff, so we had to get an extra office. We had to get an extra computer and a desk, and then some other miscellaneous capital. So brought us in around $63,000. So we had a profit of $2,000. So that was pretty exciting. But we didn't go in the hole, so that's good. Now some of that we probably use to subsidize some clients, because we subsidize anywhere between $3,000 and $7,000 a year. We fundraise to subsidize our clients to get transportation to pay on their behalf. So a sustainable budget would look in the far corner, would be if we got $8,000 revenue, and then if we paid around $72,000, it would be wonderful to have a full-time and a part-time coordinator. We could probably do more than double the agencies we are doing with a small investment of $72,000. And then there's always extra office space, miscellaneous capital. So to sustain the project would be around $72,000. Right now we have one full-time person, and we have capped the number of drives we can do for agencies, and we are not taking any new clients. So statistical information, just to kind of show you, this is for the year 2012. I wanted to give you a full year. So the Trans Hub total is 1,315. So these are people below the age of 65. And we had 63 clients, 1,300 trips. And then the SOS clients, and this was over 55 because we used to count them over 55, was 2,999. So we have enough work to do without going out and doing more. But because it's such a worthwhile program, we just know people need it. We know agencies need it. And we do around 359 individuals. And there hasn't been a year that that number hasn't gone up. So that's a lot of coordination of drivers, a lot of coordination of trips for one individual. So that's a pretty good deal for the system. I think you would agree with me on that. So project benefits, the ability to collaborate agencies identified as providing transportation services to a wider range of ages. More transportation options is one of the key resources required to enable individuals to access services within the health system. These are mostly medical appointments. These are people that need to get to the hospital doctors. If they don't get there, what's going to happen? And reduces a big percentage of staff time. When we did a survey of these 17, 18 agencies, approximately 20% devoted to arranging for volunteer driving within their agency or driving individuals themselves. That can't be a good use of resources. With large caseloads, this does impact on the ability to provide other much needed supports to their clients. And a few more benefits. And just kind of ignore that, Wendy, could you incorporate? I forgot to take it out. I had some help with getting my slides together today. So, but some more benefits were serve more individuals wishing to visit family members, participate in social and leisure activities. Although we don't do much of that, we still do that, and we do that for the other agencies, especially if they have to go to an education. Someone from mental health has to go to an education seminar. And most importantly, SOS has been able to demonstrate the Trans Hub works. So I have a couple success stories that came in. And the ODSP worker, Tanya, the rapport between our agencies is excellent. The Trans Hub coordinator and volunteer drivers offer more than just a drive, but also a comfort and support to clients that are dealing with disabilities of all different capacities. Communication and follow-up through with the drivers and clients is excellent. The financial savings for partnering agency is substantial. That's pretty big. They're the ones we've had to cap, and they just phone all the time. Can we give you more clients? Can we give you more clients? Here's another one. This is an anonymous agency worker because she didn't get approval from her supervisor. The Trans Hub has filled a gap with our agency in transporting clients from out of town especially. These clients may not be able to get into town for appointments without this service. The program is safe and reliable, as well as promoting continuation in drivers. This makes the clients with various issues to feel less anxious. The clients are treated with kindness and are provided with a sense of self-worth. The workers find that it is very user-friendly and provides extra assistance to vulnerable clients. There is great communication on all levels, and it is more than just a transportation service. Wow, I thought that one was really wonderful. So some of our gaps, strengthening our gaps. The transportation system is fragmented, and this is a blurb kind of from the LIN. So the LIN said this: with agencies working in silos, to find solutions to transportation needs. Common approaches, practices, principles, and planning both within sector and across sector is required. So this is where I felt this should go in, because this is, the Trans Hub is doing this outside the box. So maybe we couldn't do something regional, going back and forth. Maybe there is something done, but we did something on a smaller scale. There are many bonuses in having one agency responsible to do the transportation. For example, yearly training to the volunteers. Agencies are not using staff time for travel. Volunteers see this as their job. And then one more. There we go. Create transportation coordinator. Current transportation coordinators do not just do Trans Hub screening. Coordinators have many LIN funding responsibilities. So my coordinator is just not sitting there doing transportation coordination. They are also doing foot care. They are doing other programs, caregiver respite. They are checking in with the PSWs. So they are never just doing one program. No new base funding coming into the CSX sector means the Trans Hub program is currently capped, and then we're not taking on new clients. And right now, the board has agreed that we have a 6-month contract with Career Edge, where they're paying a percentage of the salary to this one staff person. And after that is over, Trans Hub may not cease to exist anymore. The Trans Hub is working so well that it would truly be a disaster if such an excellent example of efficiency and collaboration would be terminated because lack of funding support. And the LNA SOS has been able to demonstrate conclusively that the Trans Hub works. Clients and participating agencies have expressed their appreciation for efficiency and cost-effectiveness of the program. The program has the potential to be used as a model for other communities in the Southeast Lynn region. In order to ensure continued success of the program, additional financial support is essential. $72,000 would support staffing and allow for more agencies to become a partner. The cost benefits to the system are self-apparent. To transport a medical patient to Kingston by taxi is $180 round trip, and by the Trans Hub is $60 round trip. Taxi charges $1.90, and SOS charges 60 cents a kilometer. In the absence of Trans Hub, the taxpayers would be paying 3 times the cost per trip to Kingston. So, but it works. It is a good system. We're delighted to have been able to offer it.